Most people believe that weaker legs are simply the price of getting older. You wake up one day and notice stairs feel harder, balance feels less certain, and standing up takes more effort than it used to. The explanation you're usually given is age, but age is only part of the story, and not the most important part. What actually happens is far quieter. As the years pass, the body slowly loses access to specific nutrients it needs to repair muscle tissue. Not because you're doing something wrong, but because absorption changes, hormone levels shift, and the systems that once worked efficiently begin to slow down. When those nutrients are missing, muscle repair doesn't stop entirely. It just becomes incomplete. Night after night, the body tries to rebuild your leg muscles and falls short. That's why so many older adults exercise, stay active, and still feel their legs getting weaker. What rarely gets discussed is that leg strength isn't rebuilt while you're moving. It's rebuilt while you're sleeping, and the window for that repair is surprisingly specific. Late at night, especially between 10 at night and the early hours of the morning, your body releases the highest levels of growth hormone it will produce all day. Blood flow to your muscles increases, inflammation quiets down, repair signals switch on. But repair only works if the raw materials are already there. Imagine trying to renovate a house overnight. The crew shows up, the lights are on, the plan is ready, but the supplies never arrive. No wood, no cement, no tools. That's what happens inside your legs when key vitamins are missing at night. The repair process begins, but nothing gets completed. Research shows that older adults who support their bodies with proper nighttime nutrition experience dramatically better muscle protein synthesis than those who don't. In simple terms, their muscles actually rebuild instead of slowly breaking down. Balance improves, strength returns, independence lasts longer. This is where 3 specific vitamins come into play. They're not exotic, they're not trendy. And because they're inexpensive and widely available, they're rarely promoted. Yet missing even one of them has been linked to slower muscle repair, higher fall risk, and frequent leg cramps after 60. The first of these is vitamin D3. Many people assume vitamin D isn't an issue because they spend time outdoors. But after 60, the skin becomes far less efficient at producing vitamin D from sunlight. Even regular sun exposure often isn't enough anymore. And without sufficient D3, your leg muscles lose one of their most important signals for growth and repair. Vitamin D3 plays a direct role in activating the genes responsible for building muscle protein. Without it, your muscles receive the message to repair, but they can't fully respond. Over time, this leads to loss of strength, slower reaction time, and reduced balance. Long-term studies following thousands of older adults have shown that those with healthy vitamin D3 levels maintain significantly more leg muscle mass than those who are deficient. And the effect is especially important for a specific type of muscle fiber, fast twitch fibers. These are the fibers that allow you to stand up quickly, climb stairs, and catch yourself if you stumble. Unfortunately, they're also the fibers that decline fastest with age. Vitamin D3 is one of the few nutrients shown to help preserve and support these fibers. Timing matters here. When vitamin D3 is taken at night, it's present in the bloodstream during peak repair hours. The body doesn't have to wait. It can immediately use it to activate muscle-building processes while you sleep. Studies comparing morning versus nighttime intake have found noticeably greater improvements in leg strength when D3 is taken before bed. When D3 levels are low, the consequences go beyond weakness. The communication between your brain and leg muscles slows down. Signals take longer to arrive. That tiny delay may not seem like much, but it can be the difference between regaining balance and falling. This is one reason vitamin D deficiency is so strongly associated with falls in older adults. Some people also notice persistent leg fatigue or unexplained pain. Often, it's not a mysterious condition. It's simply muscles struggling to function without adequate D3. For most older adults, an intake between 2,000 and 4,000 IU of vitamin D3 taken at night is commonly recommended. The form matters. D3 is far more effective than D2, and because it's fat soluble, absorption improves when it's taken with a small amount of healthy fat. Restoring low levels takes time, especially if deficiency has been present for years. Many people begin to notice improved stability and energy within a month, but full benefits often develop over several weeks. Of course, supplements should always be discussed with a healthcare professional, especially if you're taking medications for heart or blood pressure conditions. Vitamin D3 lays the foundation, but on its own, it isn't enough. Your legs need additional support to complete the repair process. That's where the second vitamin comes in, and it's one many people overlook entirely. And after that, there's a third, one that rarely gets mentioned at all, yet may be the most powerful of the three. Once vitamin D3 sets the signal for muscle growth, your body still faces another challenge. Signaling alone doesn't rebuild tissue. Muscles also need the ability to relax, repair, and chemically assemble new fibers. That's where the second key nutrient comes in, magnesium, specifically magnesium glycinate. Most people associate magnesium with sleep or occasional cramps, but its role in leg strength goes far deeper. Magnesium is involved in hundreds of enzymatic reactions throughout the body, many of which are essential for muscle protein synthesis. This is the actual construction phase of muscle repair, where damaged fibers are replaced with new ones. Without enough magnesium, that construction process stalls. The blueprint exists, but the chemistry never finishes the job. Magnesium also plays a critical role in controlling calcium inside your muscle cells. Calcium triggers muscle contraction, but magnesium is what allows the muscle to release and relax afterward. When magnesium levels are low, calcium becomes trapped inside the muscle cell. The result is prolonged contraction, tightness, stiffness, and those sudden nighttime cramps that pull you out of sleep. This is why magnesium deficiency is so strongly linked to leg cramps, especially in the calves. Studies have shown that older adults with healthy magnesium levels experience significantly fewer nighttime cramps and better overall muscle performance. Their legs don't just feel stronger, they recover faster. Taking magnesium before bed matters. During deep sleep, your leg muscles naturally go through cycles of tiny contractions and releases. This process is part of normal repair. Magnesium supports this rhythm. Without it, those microcontractions can escalate into painful spasms, disrupting sleep and cutting muscle repair short. Poor sleep leads to poor recovery, and over time, weaker legs. The form of magnesium makes a major difference. Many supplements use magnesium oxide because it's inexpensive, but it's poorly absorbed. Only a small fraction actually enters your bloodstream. Magnesium glycinate, on the other hand, is highly bioavailable and gentle on the digestive system. It stays active through the night, supporting both relaxation and tissue repair without causing stomach upset. When magnesium is lacking, the signs are often subtle at first. Muscles feel tight in the evenings. Recovery from simple activities takes longer than it used to. A normal walk can leave your legs sore for days. Over time, muscle fibers become more fragile, increasing the risk of strains and small injuries during everyday movements. What makes this especially concerning is how common magnesium deficiency is. The majority of adults over 60 don't get enough, largely due to changes in digestion, medication use, and lower dietary intake. This means many seniors are dealing with unnecessary muscle weakness simply because one key nutrient is missing. At this point, you have two essential pieces in place. Vitamin D3 sends the growth signal. Magnesium glycinate allows muscles to relax, recover, and rebuild. But there's still one missing element, the one that determines whether all this work actually results in strong functional legs. That final piece is vitamin K2. Vitamin K2 is rarely mentioned in conversations about muscle strength, yet it may be the most decisive factor of all. Unlike vitamin K1, which helps with blood clotting, K2 acts as a director for calcium in the body. It decides where calcium goes, and where it doesn't. As we age, calcium distribution becomes disorganized. It starts accumulating in places it shouldn't, such as soft tissues, arteries, and muscle cells. while slowly leaving the places where it's needed most. This imbalance weakens muscle contraction, increases stiffness, and interferes with physical performance. Vitamin K2 activates proteins that escort calcium into bones and structural tissues while preventing it from settling inside muscle fibers. This keeps muscles flexible, responsive, and strong. Without K2, even well-intentioned calcium intake can backfire, contributing to stiffness rather than strength. Research following older adults who supplemented with vitamin K2 has shown meaningful improvements in leg strength and physical performance over time. The effects become even more powerful when K2 is paired with vitamin D3. D3 initiates muscle building processes, while K2 ensures calcium is used properly during that process. Together, they create balance. Taking K2 at night is especially effective. During the same hours when muscle fibers are being rebuilt, K2 ensures calcium supports structure instead of interfering with function. It's the quality control step that turns repair into real strength. When K2 is missing, legs often feel stiff in the morning. Strength seems to decline despite no change in activity. Joint discomfort, particularly in the knees, becomes more common as calcium drifts into soft tissues rather than reinforcing bone and muscle systems. For most adults, a nightly dose between 100 and 200 micrograms of vitamin K2 in the MK7 form is commonly recommended, taken alongside vitamin D3. MK7 remains active longer in the body, making it ideal for overnight repair. However, anyone taking blood-thinning medications should always consult a healthcare professional before adding vitamin K2, as interactions are possible. When these three nutrients work together at night, the body finally has what it needs to rebuild leg strength the way it was designed to, quietly, naturally, and while you sleep. At this point, the picture is complete. You now understand the role each vitamin plays. Vitamin D3 to activate muscle-building signals, magnesium glycinate to allow repair and relaxation, and vitamin K2 to guide calcium where it belongs. The remaining question is not what to take, but how to use them in a way that actually supports overnight muscle rebuilding. The most important factor is timing. Your leg muscles don't rebuild during the day. They rebuild at night, during deep sleep, when growth hormone is naturally released and blood flow to muscle tissue increases. That's why these three nutrients work best when they're taken together, about 30 to 60 minutes before bedtime. Taken at that time, they're already circulating in your system during the most critical repair window. Many people worry that supplements taken at night might interfere with sleep. In this case, the opposite is usually true. Magnesium, in particular, tends to calm the nervous system and support deeper, more restorative sleep, exactly what muscle repair depends on. For vitamin D3, most older adults do well in the range of 2,000 to 4,000 IU per night. A sensible approach is to begin at the lower end for the first couple of weeks, then increase gradually if you tolerate it well. Because vitamin D3 is fat-soluble, absorption improves when it's taken with a small amount of healthy fat. Some supplements already include this, while others can be taken alongside a few nuts or a light snack. Magnesium glycinate is best taken in the range of 300 to 400 milligrams at night. Starting lower and increasing slowly allows your body to adjust. If digestion becomes uncomfortable, that's usually a sign to reduce the dose slightly rather than stop altogether. The glycinate form is preferred because it's both well absorbed and gentle on the stomach. Vitamin K2 should be taken alongside vitamin D3, never on its own. A nightly amount between 100 and 200 micrograms is commonly used, and the MK7 form is ideal because it stays active in the body longer. Many people find combination D3 and K2 supplements helpful as long as the dosages and form are correct. Consistency matters more than anything else. Muscle repair is not a one-night event. It happens gradually, cycle after cycle, as long as your body has the materials it needs. Skipping nights means skipping repair. Setting a simple reminder can make all the difference. It's also important to give the process time. Some people begin to feel steadier on their legs or notice fewer cramps within a few weeks, but meaningful strength changes usually take a month or more. Full rebuilding can take several months. This is normal. You're restoring tissue, not flipping a switch. Hydration plays a quiet but important role as well. Muscles function and recover better when the body is well hydrated. Making a habit of drinking water throughout the day supports everything these nutrients are trying to do at night. Finally, these vitamins work best when your muscles are given a reason to rebuild. That doesn't mean heavy weights or intense workouts. Simple movements, standing from a chair, gentle squats, calf raises, or walking with light resistance are enough to send the signal. The vitamins provide the materials. Movement provides the message. One last point deserves emphasis. These nutrients are not optional pieces you can mix and match. They function as a system. Vitamin D3 without K2 can create imbalance. Magnesium without D3 won't stimulate rebuilding. All three are needed, taken together night after night. To bring it all together, your leg muscles are designed to repair themselves while you sleep, but only when the right nutrients are available at the right time. Vitamin D3 turns on the growth signals. Magnesium glycinate allows relaxation, recovery, and proper repair. Vitamin K2 ensures calcium strengthens your body instead of interfering with it. When these three work in harmony, the environment your legs need to rebuild is finally restored. Stronger muscles, fewer cramps, better balance, and more confidence in movement are not unrealistic goals. They're the natural result of giving your body what it's been missing. Your legs have supported you for decades. Supporting them now is not about doing more. It's about doing what works. Start tonight. Give your body the tools it needs and allow the rebuilding to happen while you rest.